You're freaking out after your cervical biopsy because they called and said there are abnormal cells that are present. Hi, I am your local OBGYN. I love women, and let's talk about it. When we do a colposcopy, we are looking for something like CIN, cervical intraepithelial neoplasia. It sounds super scary, but I promise you that in itself is not a cancer diagnosis. It comes in levels. CIN1 is the most mild abnormality that we see. This is the most common one that we find. It is something that usually when we do nothing but monitor it will resolve in 70% of women in 1 to 2 years. Very few does it progress on, somewhere in like the 10% range. That being said, if we see more significant change, it can be CIN2, where there's more cells with more abnormality. This resolves a little bit less frequently with a slightly higher chance of progressing on. We will talk about doing a treatment for it depending on what somebody's wishes are for future pregnancies and what their risk factors are. CIN3 is the most concerning because it's called carcinoma in situ. That being said, this is the one that has the highest chance of turning into invasive cancer and the lowest chance of resolving on its own, which is why we usually recommend that you have an excision procedure or something done to remove that abnormality. All of these changes take years to happen, so you don't go from nothing to something overnight. So if you keep up with regular pap smears, that you should be okay. But the biggest things that can be on your side are healthy immune system, don't smoke, healthy diet, okay? Some people will add things in like folic acid, vitamin C, and vitamin E as well, which have shown some mild benefit in studies.